Hi, my name is Nurse Snezhana Pasichnik, and I will be collecting your health information today. Can you please state your name?
Hi, I'm Elizabeth Vasquez.
Okay, Miss Elizabeth, and can I call you Elizabeth?
Yeah, you can actually call me Liz. I go by Liz for short.
Okay, Liz. And what's your date of birth?
February 6th of 89.
Okay, and what brings you to the office today?
I've been feeling really tired and weak, and I just want to kind of sleep all day. And I've been diagnosed in the past with iron deficiency anemia, and so I'm in today just to get it checked out.
Okay, and how long ago did you get diagnosed?
I was diagnosed maybe about two years ago.
Okay, and do you take any medication for that?
I take iron tablets.
Okay, and how often do you take them?
Daily.
Daily, and do you
Well, I don't take them daily. I think it's been so when I was diagnosed 2 years ago, I took them for a little while, and then just until I got my iron levels back up, and then I recently started taking them again when I started feeling tired and everything.
And how often do you feel tired? Is it every day or like once in a while?
Yeah, it's pretty much every day.
And on a scale of 0 to 10, and 10 being the highest, where would you rate how tired you are?
I'd say about a 6.
A 6. Oh, okay. And do you notice certain times of day where you feel more tired? Is any time of the day or more in the evening?
I do notice when I'm exercising or out walking or going up the stairs, I do notice that I do feel winded. As far as feeling tired, it's usually midday, I'll start to feel really sleepy. At night, I'm really sleepy as well.
Okay. And I will ask you a few questions about your background.
Okay.
And so, where are you from, and your family?
My parents were born and raised in Mexico.
Okay.
I was born here in California.
Okay. And what is your primary language? I see you speak English. Good.
Yeah.
Do you speak any other languages?
I do. I speak Spanish as well.
Oh, that's good.
I would say that English is my primary language, but I am bilingual.
Okay. And do you practice any religions?
Yeah, my family and I are Catholic.
Okay. Do you work anywhere right now?
I was working for a school district as an LVN, but I decided to go back to school to become an RN. So I'm back in school, and I'm a full-time student now.
Good job. That's hard. Good luck to you with that.
Thank you.
So, being at school and with the COVID going around, have you been exposed to anyone recently?
No, I haven't been exposed. We haven't started clinical just yet, so I haven't really been around any patients. But I haven't been around anybody else.
Do you guys wear your masks around each other?
Yes, we do.
In the school setting?
We do wear masks.
Okay. And I will ask you a few questions about the history. Do you have any smoking? Do you smoke or drink alcohol?
I don't smoke, but I do drink alcohol on occasion.
Okay. How often?
I would say maybe once or twice a month. I'll have a couple drinks.
Okay. And how many drinks? 2, 3?
I'd say 2 to 3.
Okay. Okay. And do you use any recreational drugs?
No, I don't.
Okay, that's good. And what kind of diet would you say you have?
I'd say I have a pretty good diet. I focus more on like fruits, vegetables, and trying to make like a smoothie in the morning, like with kale, spinach, and try to incorporate like good veggies and fruits.
That sounds very yummy.
Yeah.
And do you exercise often?
Not as often as I used to. I did exercise probably like 5 days a week, but now I've just been so busy I haven't found the time to exercise. So I do like a walk on the weekends or something, but that's as much as exercise I've been doing lately.
Yeah, it's hard to find the time and being so busy, but it is very important to try to find at least a little bit of time to get that exercise in. And do you use any other kinds of therapies or?
Like I don't go to therapy. I don't have any therapies.
Okay. Have you had any previous hospitalizations or surgeries?
No, no hospitalizations or surgeries.
Okay, and when was your last physical exam done?
My last physical, I would say a couple months ago, back in August.
Okay, and what were there any problems, or was everything okay?
Everything seemed to be okay. I think they did some labs, and I know they mentioned that like some of my labs were low, and so they wanted me to continue my iron.
Okay.
So.
And do you have follow-up appointments with your primary?
Yes, I do.
Okay. And what's your menstrual cycle like?
It's actually pretty heavy.
Pretty heavy. Okay. And how do you feel with the tiredness of being diagnosed with anemia? Does it change during your menstrual cycles?
I guess I feel more tired after. I start to feel really tired. I guess after a few months, once I had gotten back up, a couple years ago when I had anemia, I felt better, but my menstrual cycle was still the same. It was still heavy, and then afterwards, I still feel tired a lot. Really tired.
And what do you, besides iron, do you take any other medications?
I take a multivitamin as well.
Multivitamin. And how often?
I take that maybe like once or twice a week.
Okay. And how long have you been doing that, taking the multivitamin?
For a while now, like probably, I want to say maybe like 10 years or so.
Oh, that's good. And when was the last time you took one?
The last time that I took one was probably yesterday.
Oh, that's good. And do you take any other medications, like over the counter?
No, just my iron and the multivitamin.
Okay. And do you have any allergies to medication?
Not that I know of.
Okay. And what about food? Do you have food allergies?
No.
And do you have any other sorts of like latex allergies?
No latex allergies.
Okay, that's good. And do you have any seasonal allergies or environmental?
I do get seasonal allergies during the springtime. And lately the summer as well. But they're not too bad. It's just a little bit of a scratchy throat and a little bit of a runny nose, and then it'll either go away on its own, or usually I get like Zyrtec or Claritin to help.
And normally Zyrtec relieves the symptoms?
Yeah.
Okay, that's good. And I will ask you a few questions about your family history. So I will list the conditions, and if you could just answer yes or no to them. Does anyone in your family have diabetes, high blood pressure, stroke, seizures, heart disease, kidney disease, or cancer?
Yes, my dad has diabetes and heart disease and high blood pressure.
Okay. And does anyone else in your family have?
No, my mom's healthy. It's just my dad.
What about your grandparents? Do they have any of these?
No.
No.
Okay. My grandparents have passed already.
Mm-hmm.
And I can't remember if, I don't believe that they had any hypertension or diabetes.
Okay.
So.
And your dad, what kind of diabetes does he have?
Type 2.
Type 2. Okay. And do you know how high his blood pressure is?
Yeah, his blood pressure, he's on medication, so I think it's getting him pretty stable.
Mm-hmm.
But I think it would go as high as 150s.
Okay. And what about you? Where is your blood pressure normally? Like, is it high? Is it low?
Usually my blood pressure is pretty low, under the 120 mark.
Okay. And have you ever had any glucose problems?
No.
Okay. And are you married or single? Or?
I'm single.
Okay.
But I do have a daughter.
Oh, that's how old?
She's 7 years old.
Oh, what's her name?
Esme.
Esme. That's very pretty.
Thank you.
So you must be very busy.
Yeah. With school, my daughter, getting her to school, and it keeps me busy.
Yeah.
This lifestyle.
So you're single, but do you have any sexual partners?
I just recently got out of a relationship, so at this moment I don't have any sexual or partners or anything of that sort.
Okay. And what are your living arrangements like? Do you live alone or with parents?
I recently moved back in with my parents, so I'm my mom and my dad and my daughter.
Oh, that's sweet. And what would you say the support is like at home?
Oh, great support. my parents help me a lot, especially with me going to school and everything.
Okay.
My daughter, me being a single mom, they help me a lot.
That's very important to
Yeah.
have that support from family, especially during
Yeah.
nursing school and having a 7-year-old. I'm sure you need other help with her
Yeah.
to get your homework and stuff done.
Yeah.
So would you say your stress level is high or low?
I would say my stress level is actually pretty high right now. Just starting a nursing program, my stress level I feel is really high because I'm still adapting to figuring out how to get my daughter to school and everything. And I know my parents are helping me, but I feel like I don't want to, have them do all of that for me. Like I want to be able to balance out my day, and I still haven't been able to figure out a schedule. So
it takes a while to figure out, especially when something's new, until you kind of get used to a certain routine or schedule.
Yeah.
So what would you say your coping strategies are for that stress?
I usually try to do walks. Usually I exercise, but that hasn't been the case lately. So I'll take my daughter out on a walk on the weekend, and so we'll go for a walk, and that kind of helps. Other than that, just been dealing with the stress.
Do you get a good night's rest? Do you get like 7 or 8 hours of sleep?
I would say between 6 to 8. It varies depending on the day.
And do you find yourself having like bad, depressing thoughts?
No, I don't think I haven't had any like depressive thoughts or anything like
And what would you say your anxiety level is? I know being in nursing school, it's hard.
Yeah. I mean, my anxiety, I would say, is pretty high. But I think at this moment with my parents' health, I am able to cope with it right now.
Mm-hmm.
I think I got their support, so I think that's definitely relieved a lot of anxiety that I've had.
Of course, that's very important to have that support and help from your family. So overall, you are healthy. You try to exercise, and exercising is very important. And obviously, you're busy, and it's hard to find the time. But when you can, to find the time, maybe like once, twice a week at least, or like go on a 30-minute walk. That's still good exercise. And your anemia is getting a little bit iffy about when your menstrual cycle is, and you feel tired all the time. So I would recommend continuing taking the medication and not skipping any doses like you have been. You've been being very good about that. And just I will let your physician know that you're starting to feel more tired, so maybe he could recommend something else. But overall, I think you're doing a great job, and keep up with the good work.
Okay.
And it was very nice to meet you.
It was nice meeting you.
Thank you.